Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Psychiatric conditions with the neurotransmitter activity. So to begin with, we start with depression. So we're starting with the depression. So in terms of depression, the associated neurotransmitter activity is there is decrease. So in depression, there is decrease of serotonin. So depression, there is decrease in the serotonin as well as norepinephrine. So there is a significant decrease in three things. So serotonin, there is a norepinephrine, and then there is also a decrease in the dopamine. So three things are decreasing in depression. Next, let's look at mania. So in terms of mania, it includes the increase in the dopamine and decrease in the GABA. So there's increase in the dopamine and the decrease in the GABA. So there's an increase and decrease, and this takes place in the mania. Next is the most important, there is schizophrenia. So in schizophrenia, it is an increase in the DS, there is a dopamine as well as increase in the serotonin. Two are increased. Next is we move on to the anxiety. So when you're anxious, in anxiety, the increase in the norepinephrine. So there's increase in the norepinephrine as well as there is decrease in the GABA. So it's similar to that of mania, where there's an increase in one and decrease in one. In mania, it was increase in dopamine and decrease in GABA. Here in anxiety, it is increase in the NE and the decrease in the GABA. And also the serotonin as well as the decrease in the serotonin. Then we move on to the Alzheimer's disease. So in case of Alzheimer's disease, let's look at Alzheimer's disease. So in case of Alzheimer's disease, there's a decrease in the norepinephrine. So Alzheimer's, we call it as NE, that is norepinephrine, as well as a decrease in the acetylcholine. So two things decreases in Alzheimer's, norepinephrine as well as the acetylcholine. To learn and grow daily like this, please do subscribe.